Welcome to our sonography lecture on Pediatric Abdomen Pathology, Part 2 of 7, Biliary Pathology for the Sonographer. This lecture will cover biliary atresia and choledocal cysts. We're going to begin then with biliary atresia. Now, biliary atresia refers to the biliary tree not developing the way that we would expect to. And that's because there is either a narrowing somewhere within the biliary tree or premature development, which typically means that it doesn't develop really at all. Now, this can affect intra or extrahepatic ducts, and it doesn't always include the gallbladder. Males are more likely to develop biliary atresia, and the biggest clinical sign that we're going to see of this is jaundice, and that's because the bilirubin doesn't have a way to get out of the hepatocytes and into the bile ducts, so instead it spills out back into the blood, causing the patient to become yellow. When this happens, it's going to happen pretty early on because the liver is already producing bile within the womb, so when the child comes out, they're going to be pretty sick pretty quick and with that yellow skin. On ultrasound, the biggest thing you need to take away from biliary atresia is that there's something called the triangular cord sign, and this is found just superior to the porta hepatis. And what this represents is kind of a rudimentary or a premature blob of tissue that was supposed to be the bile duct. So if you think of biliary atresia, has that A, kind of looks like a triangle, try to remember that goes along with the triangle cord sign. So here's an example of the cord sign. We can see the liver. This is the portal vein, and just superior to it, you're going to have a very echogenic triangular blob of tissue. Now, the other part with biliary atresia is that you're not going to be able to visualize other ducts. So you should not be able to see a common hepatic duct or the common bile duct. Next up then, we have choledocal cysts. Choledocal cysts is something that we have visited in the past when we talked about hepatic cysts, but choledocal cysts, as a reminder, are cysts that form of the biliary tree, typically representing some sort of dilation of the biliary tree. There are 5 variants of choledocal cysts. Type 1 is the most common, in which we get a choledocal or kind of a fusiform expansion of the common bile duct. Type 2 is bile duct diverticulum, which is like a little outpouching off the bile duct. Type 3 is a choledocal seal, which is the bile duct kind of bubbling into the duodenum. Type 4 is intra or extrahepatic ductal cysts, so we'll see little bulbous ducts spread throughout. And then Caroli's disease, which is rather rare, is type 5. And that's going to affect the intrahepatic ducts. If you recall back, that one had the central dot sign that represented the hepatic artery, and it looked like a bunch of cysts scattered throughout the liver. Asian children are more commonly affected by choledocal cysts. Here's another review then of the types of choledocal cysts that can be found. Remember that type 1 is the most common. With type 1, we see in fusiform enlargement of the common bile duct. It looks like kind of a large cystic space that sits in between the liver and the pancreas. Type 2 then is a diverticulum, so we can see a little outpouching off of the common bile duct. Type 3 was a choledocal seal, so we have a bubble of duct that expands into the duodenum. Type 4 were intra or extrahepatic dilations. And then type 5, Caroli's disease, the very rare one, we see little dilations or cystic spaces within the liver. So let's take a look at what type 1 looks like, since it is the most common variant. And remember, this is diffuse dilation of the common bile duct. So here we have the liver and the pancreas head, and in between we have a large cystic space. We would not be able to find a common bile duct because this is the common bile duct. And that brings us to the end of biliary pathology in the pediatric population. Up next, we're going to talk about Part 3, GI tract pediatric pathology.